My name is Anil Rustgi. I'm Chief of Gastroenterology at the University of Pennsylvania. My research and clinical interests are in pancreatic cancer. From a research viewpoint, our group is interested in identifying the mechanisms that lead to the initiation, progression, and spread of pancreatic cancer. And clinically, I'm heavily immersed in the identification and characterization of patients and their family members that have a family history of pancreatic cancer and other pancreatic cancers in order to see if genetic testing and counseling may be feasible. A question that I'm often asked relates to what are the symptoms that I may experience if I have pancreatic cancer. Unfortunately, there's not one symptom that clearly defines pancreatic cancer. And in fact, there's a whole spectrum of symptoms that can be attributable to pancreatic cancer, and I will delineate those, recognizing that it's very, very important that a constellation of symptoms merit evaluation by one's physician to see what further evaluation is necessary in terms of diagnostic testing and otherwise. Some of the symptoms that may be attributable to pancreatic cancer include mid-abdominal pain that's relatively continuous or persistent, that could radiate to the mid-back. That's due to the fact that pancreatic cancer cells have an attraction for neurons or nerve fibers, and those neurons that go from the pancreas that's embedded deep in the abdominal cavity radiate or traverse from the mid-abdomen to the mid-back. There can be nausea or vomiting. Vomiting may be of undigested food or liquid. With that can be a decrease in appetite, weight loss, as well as a sense of malaise or fatigue. And so these types of symptoms definitely are quite concerning. That being said, sometimes individuals can have very non-specific symptoms that may not even represent pancreatic cancer. So there's an overlap of symptoms in the GI tract that may be attributable to other diseases and disorders versus pancreatic cancer. So the best policy, the best pursuit is to have an annual history and physical examination, tests as needed by one's physician in terms of preventive medicine, but certainly if there's an accumulation of the symptoms that I mentioned, then that necessitates much earlier evaluation for the possibility of early pancreatic cancer.